Regarding drugs, as I said earlier, it will be a zero tolerance policy which will be followed. A full-time additional DG has been, senior officer has been posted in the TS Narcotics Bureau, and a specific focus will be on ganja, alpha-venom and other drugs which are being used by in the state. We need to dismantle the drug trafficking networks, and we have to target both the supply and demand sides of the trade. Just targeting the consumers will not help. We have to ensure that the supply of drugs itself is stopped. So as I said earlier, tough action will be taken against any drug peddler who is selling drugs in and around the premises of schools and colleges, and we have issued directions to all educational institutions to form anti-drug committees across the state. We will invoke PD Act, that is a Preventive Detention Act, against drug peddlers, and also attachment of property will be initiated against all those who indulge in the offences relating to drugs. We will also prioritize prevention and education programs aimed at raising awareness about the dangers of drug abuse, and we will provide support to those who are struggling with addiction. These two things go hand in hand. Just stopping of drugs will not help. We have to also ensure that those addicted to drugs are given the relevant support and help for de-addiction. So we will coordinate with other departments and ensure that both things go hand in hand. Both enforcement, prevention and rehabilitation will be taken up simultaneously. I would also like to mention some figures about the State Cyber Security Bureau, though I spoke about it in the beginning, but there are some statistics which make our state the first and the leader in the country. A total of 89,783 complaints were received during this year after the formation of this bureau, which is about 8% of the complaints received in the country. Telangana stands first in the country in terms of the FIRs filed based on these complaints. The national average of conversion of complaints to FIR is about 2.5%. In Telangana, it was 16%, the highest in the country.